my name is Wendy and today I'm going to be discussing cystic fibrosis. Woe to the child who tastes salty from a kiss on the brow, for he is cursed and soon will die. Excuse me. What does that mean? It's actually an ancient proverb, and according to Columbia University Medical Center, it's a proverb that forewarned caregivers and parents of children with salty skin that their child was not going to live to adulthood. It wasn't until the 1980s, according to the Cystic Fibrosis Foundation, that the gene that causes cystic fibrosis was actually discovered thanks to the help of gene sequencing. Hello all, my name is Wendy and today I'm going to be discussing with you the cause of cystic fibrosis, the treatments, as well as the life expectancy. It's a subject that I hold near and dear to me because both me and my sister, who is my identical twin, were both born with this disorder. According to the Cystic Fibrosis Foundation, about 40,000 Americans have cystic fibrosis and 100,000 individuals worldwide suffer from this condition. Currently, there is no cure, and despite treatments, it is still very fatal. So, before we get started, I just want to briefly discuss the subjects that I'm going to be talking about, including the cause, signs and symptoms, diagnostic testing, treatments, and current life expectancy. So, first and foremost, I just want to say that cystic fibrosis is not contagious, it is hereditary. And I really like this infographic from the Cystic Fibrosis Foundation. It goes on to explain that if both parents are recessive carriers of the gene, there's going to be a 50% probability that the child's going to be born simply a carrier, a 25% probability that the child's not going to be affected at all, and then a 25% probability that the child is going to be born with cystic fibrosis. Currently, that we know of, there's about 1,000 CF-causing mutations, and because of this variability, it makes it really hard to come up with a one-size-fits-all approach to treating the condition. Depending on the type of mutation that an individual has, their manifestations may be mild or more severe. The name of the CF gene is called the CFTR, which stands for the cystic fibrosis transmembrane regulator, which is responsible for controlling the amount of sodium that goes in and out of our cells. And when that is compromised, you're going to see a lot of very thick secretions in the lungs, the pancreas, and other organs that produce mucus. So some signs and symptoms that you're going to see with a patient who has cystic fibrosis includes very thick mucus or sputum when they cough, salty tasting skin. You're going to have wheezing, shortness of breath, low tolerability to exercise, recurrent sinus infections. Sometimes we'll see nasal polyps. We're going to go on and see what my sister says about what it feels like to have cystic fibrosis during a brief interview that I had with her. I tend to tell a lot of people that cystic fibrosis almost feels like breathing in through a straw. So like if you take a straw and you breathe only through your mouth and then you like clamp your nose with your fingers, at first it's going to be like really easy, but then after a few seconds it starts getting more and more difficult. And that is just the nature of the disease because of all of the mucus that we have in our lungs and all of that inflammation that the mucus causes. It gets really hard. So now that we know a little bit about the nature of cystic fibrosis, let's dive into the diagnosis. There's two predominant ways for testing for the disease. One is the sweat test, which is very affordable and less invasive than the genetic panel. The sweat test basically just consists of inducing sweat with a special cream, and then you're going to put some electrodes that are going to collect that sweat and test it for the concentration of salt. If the results show 60 or more millimoles per liter of salt content in that sweat, it's going to be positive for cystic fibrosis. To put it in perspective, my result was actually 120. And yeah, so for the genetic analysis, because of the propensity of cystic fibrosis going undiagnosed, all 50 states actually require a newborn child to be tested for cystic fibrosis. It's actually mandatory at all hospitals. The genetic analysis is a bit more invasive and expensive than the sweat test, but still very accurate. So now that we have an understanding of the signs and symptoms as well as the diagnostics, we're going to talk a little bit about the treatments that there are. There are inhaled medications. Bronchodilators are going to open up those airways and make it easier for us to breathe. There's going to be steroids, which is going to help with the inflammation, because chronic inflammation is a huge issue for people with cystic fibrosis. All of that mucus is going to just upset the lungs a lot. Then there's going to be mucolytics, which are going to thin out the secretions and make it easier to cough up. There's going to be aerobic exercise, jogging, swimming, dancing, weightlifting, and all of that is going to strengthen the lungs and the heart. Then there's intravenous or oral antibiotics. When all of these things fail, IV antibiotics or oral antibiotics are going to help treat that lung infection. Chest physical therapy, it consists of a vibrating jacket, and all that vibrating jacket helps vibrate and shake up all of that loose, thick mucus. And then last but not least are the CFTR modulators. So this is the first of its class of its kind type of medication, which the first of it was approved in 2019 to treat just this specific population that have a specific type of gene. It has been shown to improve lung function, stabilize, and increase life expectancy. And then if all else fails, end-stage cystic fibrosis consists of receiving a bilateral lung transplant to be able to continue on with quality of life. Okay, so now that we have discussed the treatments, we're going to move on to the median life expectancy of cystic fibrosis. So as you see in this slide, that is courtesy of Cystic Fibrosis, the Cystic Fibrosis Foundation. This is the 1980s, which was around the time that the gene was found, and you see that it just exponentially increases the life expectancy. According to the Cystic Fibrosis Foundation's patient registry, individual born in the 90s with cystic fibrosis, their life expectancy today is actually 40. But a child that was born in 2023, their life expectancy is 61, which is huge. Cystic fibrosis continues to be a life-altering condition that cuts the lives of many short, but thanks to the advances in medical research, people with cystic fibrosis are living longer and fuller lives. Thank you so much for listening to my presentation.